you see just opening up the leg. And these young ladies, as I said, they are in agony. They are really in pain. Next step. So, of course, you have an improvement in aesthetic appearance, no question about it. But I always try to stress to my patient, it's not our main goal. Next step. She is, whenever you come to Germany, we have a really expensive restaurant. It's incredibly expensive, but I've never been there myself. But she was a waitress there, and her boyfriend was a cook. So he's a fancy, what do you call a chief? Chef. He was fancy, really. And they came to my office and he said, you have to do something for her because she can't stand the day anymore. She comes at home and she is in pain. She can't do anything after work. So we are a young couple, so we have to do something. And look at this. You wouldn't even notice when she is stressed that she had lipedema. But she was in pain. She was in agony. And we did her. So you see the opening of the legs. Everything was normal. She has meanwhile 2 children because often people think, do the liposuction before I get pregnant or after it. So I really recommend you do it before you get pregnant because there's no change at all. This my young ladies that did not even wear compression stockings during their pregnancies, which usually people should do. Next. A couple of other next. So just to get through. Go ahead, please. So you see that there are a lot of big differences there. Next step. She's not correct. You have one of your sponsors is MEDI, M-E-D-I. It's the world's biggest distributor of compression toppings. And she was model for MEDI. She's actually a lawyer, but she's also a fitness coach. And she couldn't do any fitness anymore. She was jazz dancing. She had to break. She had to stop during her performances because she was so in pain. She was in agony. And even worse for her, coming back to modifications, she was told from the people that she tried to coach, do I get these legs when I do that amount of exercise? So we decided to do her, and she never became really a lawyer. She liked to do sport, and that's the result after 5 years. Next step. So she lives an absolute normal life. She's pain-free. She can do her sport exercises whenever she wants. Next step. We have certain limits, of course. When you get a patient like this, you can't expect to get the same result we saw before. So, next step. So this is after half a year. Consider, and this area we have taken about 30 centimeters. It's in circumference, it's 1 foot in length. Even then, you have a skin fold. Even then, you are not back to normal size. So there are certain limitations. What you can do is just take out your fat. You don't have hammer and chisel and try to shape the leg. So, next step. But you can have, of course, big results. Next step. So, in Germany it's size 48 down to 33, 38. So it's about, you know it better than me. Next step. So, okay. And that's how she looks after the procedure. So she was a young lady with 21. She lives in the 3rd floor, and she went up to the 3rd floor, and she was overtaken by her neighbor. She was 83. And then she thought, there must be something wrong with me. So it can't be that I'm just 20, and my neighbor is 4 times as old as me, and she is quicker on the staircase than the staircase. Next step. So, what we can do is just take out the fat. There is a remaining tissue, connective tissue, fibrotic tissue. So it's not possible. What would you often think? Just they do some fancy treatment and they get every shape they want. You can't. You just can take out the fat. But as I said, you're very successful killing pain. You're very successful stopping your progression, and we are very successful getting your legs in normal alignment. Next step. What's the big difference between cosmetic and therapeutic liposuction? Pierre Fournier is the grandfather of liposuction in Europe, and he stated that a good liposuction is defined by what you leave behind to form, to shape the body, not what you have sucked up. Just the opposite is with lipedema, ladies. You does not leave behind anything because you trigger a new growth, which is autonomous. So your aim is to get rid of all this tissue, or all this fatty tissue, that it does not start again, and that it lasts a lifelong. Even you have sometimes a certain cosmetic disadvantage. So I really want to stress this. That's really important to me. So don't have expectations like this. So whenever you go to a surgeon, whenever you go to think about liposuction, have expectations that will be fulfilled. Talk to your surgeon, and he will explain you what he will probably get to. But what he can tell you is all the 3 facts I mentioned already. Very important for me. Nothing uncommon. Go ahead. Go ahead. What is really important for me is that the shrinking process took even longer than 12 months. It has a distinct difference in appearance now after 12 months to 18 months. But next step. How can you see the opening after 1.5 years? Next step. But this is really important, and that's a gait analysis. We put the patient on a treadmill, had an electronic device that transmitted the pressure in the foot to a computer, and you could see the highest pressure is the red point, the yellow, and then the green are slower, and blue means no pressure. So this lady walks typical like a knob knee. So she has all her pressure on the inner side of her feet. No treatment of any orthopedic surgeons, no treatment of any physiotherapist. 1 year after the liposuction. Look at this. Isn't it amazing? Look at this. She has a normal pressure as a normal foot has to be. So this is the evidence that liposuction can do much more than change that what you think about appearance. It is giving a lot of the patient back almost a normal life. Especially when you think about the gait analysis, when you think about walking, when you think about destroying your knee joints and your ankles. So, what can we do? We can correct the malalignment, we stop the progression lifelong, and we avoid swelling, reduce the bruising, we elevate the pain, and we restore to a certain degree the appearance. We reduce the need for compression fights when people like count early, about 60% don't need any compression. And we improve the quality of life significantly. Thank you.